Hi, Dr. Mark Agresti. I want to do a video on methadone. And what is methadone? Methadone is a synthetic opiate. It was discovered in Germany in 1937. Opiates are alkaloids of the opiate plant, the poppy plant. And what they are, they treat pain, they can be very addictive, they cause euphoria. Methadone was initially used, I think, as a pain management drug. When did it hit the U.S.? I think in the late 50s, it was FDA approved. By the early 60s, it was used in methadone maintenance clinics. And what is a methadone maintenance clinic? You have someone who has an addiction to opiates, heroin usually, hydrocodone, oxycodone, codeine, morphine, opiates. And once you're addicted to those, it usurps the body's pleasure response, meaning it takes over. And the only way to get pleasure in your life is by using an opiate. Food, sex, fun, anything else is not fun. The opiate takes over, so the only thing you think is fun is the opiate. So it's not about willpower, it just usurps the body's pleasure system, and that means it takes it over. What is the problem with methadone? Methadone was the best thing we had for a long time. Methadone treated pain, it blocked the cravings for opiates. But the problem with it was you could overdose very easily. There are people I've seen range from doses 5 to 200 milligrams. But here's the thing. If you're tolerant to it, it's fine. So someone initially could take a few milligrams and they work up over weeks, months to get to 200. So don't let down your guard. If someone who's naive and has never taken methadone before and takes 1, 10, or 20 milligram I think it's called Dolofene or methadone disc, they're dead. They'll stop breathing. Why is that? Here's why methadone is so dangerous and I really don't like it. Methadone causes respiratory depression. And unlike other drugs, methadone has a very long half-life. What does that mean? Well, heroin has a half-life 4 to 6 hours. Methadone can have a half-life from anywhere between 8 to 60 hours. So let's explain the dangers here. A normal drug would repress your breathing for about 4 to 6 hours. You'd get high, you'd nod out. A normal opiate, heroin, morphine, codeine, hydrocodone, oxycodone. But methadone's different. When you take methadone, you initially feel sedated and high for 4 to 6 hours. Then that goes away. And what remains is the respiratory depression could last for days. So, for example, my young patient, he never took any methadone before, takes 20 milligrams of methadone, goes to the emergency room, he's nodding out, he can't breathe. They give him an anti-opiate like a naloxone shot, and boom, he snaps out of it because it immediately blocks the effects of the opiate, the methadone. But the effects of blocking only last with naloxone for maybe 6 to 8 hours. And once that wears off, he goes back into respiratory depression and again. He left the hospital, went home, and he died. I have a lot of people who experiment with methadone and they overdose and they die because they have no tolerance and they're unaware of the respiratory depressant effects of methadone, which lasts for 1 to 2 days. So you see how easy it would be to die from methadone. Also, methadone is very addictive. Once you're on it, it's very difficult to come off. And for whatever reason, people crave when they're on it and they slowly increase the dose. The dose keeps getting higher and higher to block the craving. So after a while, they're on 100 milligrams, 150 milligrams, and it's very tough to get off. It could take 6 months to a year to get off by slowly tapering it. You have to be on a mission. And I think for 6 to 18 months after stopping methadone, you never feel right, you feel empty, you can't sleep. It takes years before you feel right again. I think I've explained why I don't like methadone, and there's an alternative, which is buprenorphine, which is Subutex, Suboxone. And this drug affects opiates. It's this mu receptor that methadone affects. But Subutex only partially stimulates that receptor, and it antagonizes other opiate receptors, and it stimulates others. But the main one, it antagonizes and stimulates at the same time. So it doesn't cause respiratory depression. So something like buprenorphine, which is Suboxone, or what's in Subutex or Suboxone, it blocks the craving, but doesn't cause respiratory depression. So really, you shouldn't use methadone anymore. You should use this newer drug. Methadone was the best thing we had till buprenorphine, Subutex, Suboxone, those are the brand names, came along. You're much better off using that drug than methadone. I would keep away from methadone. And methadone is like having a loaded gun in your house. If anyone were to take that, they would overdose and die, where Subutex, you can't really overdose with it. Thank you, Dr. Mark Agresti. Bye.